Welcome to the Compliance Advantage podcast. This is where healthcare executives transform compliance from a burden into a strategic asset that drives both growth and peace of mind. I'm your host, Ronan, founder of Ronan Healthcare Compliance and a healthcare compliance strategist with nearly 30 years of industry experience. I'll help you stay ahead of evolving regulations while building the sustainable, compliant organization that lets you focus on high-level strategy and exceptional patient outcomes. Remember, compliance pays dividends. Invest today. Today we have James Carey, who is a partner and head of M&A at Next Spark Growth Partners. James, thank you for joining me today. I really appreciate it.
Ross, good to be here.
Tell us a little bit about your journey. I know that you've been in this investment industry for quite a while, and then also in healthcare. Tell me a little bit about where you came from and what you're doing.
Yeah, sure. Happy to. So started my career with Wayne Huizinga and his group up in Fort Lauderdale, Florida. I've lived in it now in South Florida for almost 21 years. So my whole career has been down here in South Florida. I've certainly experienced a lot of changes over especially the last couple 5 years. But started my career with Wayne and his group. And then I was at HIG Capital for about 7 years, where we did a lot of healthcare investing, healthcare services, a lot of things that we'll talk about today. Was at a small group called Peterson Partners out in the West Coast for a couple of years. And now I'm at Next Spark. Next Spark, we are a professional family office, but we very much act and feel like a growth equity firm. Currently, we've got 16 portfolio companies that we're actively involved with. We make minority investments and majority investments, and 7 of those have a healthcare focus.
And what draws you to the healthcare side of the business?
I think, I've had a lot of experience in this space. It's something that we're also passionate about too as well. I have a big focus personally in and around health and wellness. Yep. So that naturally leads to a lot of healthcare and a lot of healthcare investing. We all wear Oura rings at our firm. All of our executives do. We do fun activities where we track our sleep, and we do dieting. So it's not only a big professional focus within the firm, but personally, and especially for myself, I'm very much passionate about it.
I love that. And usually we end with this, but I'm gonna start off with it. But when we do our things at our healthcare company too, at Ronan, one of the things we say often and frequently is you can't be part of healthcare if you're not healthy, and you shouldn't be part of healthcare if you're not. I'm a nurse, for God's sake, and in our profession, we're the worst people about taking care of ourselves as nurses. And when we look at our company, we say, look, healthcare comes first, because you cannot be in healthcare without being healthy. And one of the things that we do on a weekly basis is we do your wins and learning opportunities, but we always follow it up with, what are you doing to take care of yourself this weekend? And we make them explain it to the entire group of what they're going to do, whether that's kind of a relaxation weekend or they're going to go hike a mountain or a 14er or whatever it may be. But I think that's great that you have that same kind of mentality.
Yeah, no, absolutely. I mean, it applies personally throughout my family, throughout my friends. And naturally, as you get a little older, you have to be a little bit more mindful of your sleep and your diet and your exercise. So certainly helps professionally.
We always say health is wealth. What do you do to take care of yourself on a daily basis, other than your Oura ring, which is amazing?
Well, if I wake up with a good sleep score, then I'll typically head to the gym pretty early in the morning before getting the kids off to school. And then I'm a big believer in also in intermittent fasting. So that's also helped out tremendously. I'm fasting now, but I typically eat right after lunch. So certainly we'll start my day with some aminos but I don't break it fast until after lunch. So I'm pretty strict about that Monday through Friday. Can't say that for the weekends, especially running around with kids and going to golf or baseball, things like that. But and then I'm in the gym at least 5 times a week. So I try to be active 5 times a week. So outside of playing golf or paddle down here in South Florida, I do get to the gym and do strength training and cardio about 5 times a week.
That's amazing. Yeah, I'm a big brunch guy, so Saturdays and Sundays are kind of wonky for me too. So I understand that piece.
I mean, especially with football season coming up here, Sunday, all bets are off.
I understand. They start early on the football seasons, right?
Yeah.
When you look at Tell me a little bit, this is kind of more getting into you as well, about kind of your philosophy and your how you think about things. Is there a book, mentor, or person, or kind of a overall philosophy that's kind of shaped how you have looked at deals, or how you handled management, or how have you kind of shaped how you do things?
Yeah, I mean, one that sticks out in particular, going back to where I started my career, was Wayne Huizinga. I mean, Wayne was you know, built four Fortune 500 companies, essentially built the city of Fort Lauderdale, gave back a lot, was a tremendous with philanthropy, just a tremendous human being in general, but also a very shrewd and very successful businessman. So I got to see both sides of Wayne, and he was one of the nicest humans I'd ever met. So I think just from a young age and a pretty formative part of my career, just simple things when I'm talking to a founder or an entrepreneur, don't go in and talk about the deal, or don't go in and talk about compliance, even if that's the subject you want to talk about. Ask them about their family, ask them about their kids. So it sounds simple, and it is, but a lot of folks don't do it in my industry. They just want to get into the Q of E or the finances or the P&L or the compliance report they received from you or someone else and start talking about things that are unrelated. So I try to be as personable as possible. I really am a big believer in developing relationships with folks that I work with. And quite frankly, if I, this stage of my career, if I really don't genuinely connect on a human level with someone that I'm working with, most likely we're not going to end up being partners, or we're not going to end up doing a deal together. So I really value the relationships I get to build with a lot of founders and entrepreneurs and management teams. And so I always try to bring the human element to all things business.
It's funny you say that. And before we get into kind of our main questions on the compliance advantage, I had that same conversation with a lot of private equity or venture capitalist groups that we work with who are going into diligence deals, who, unlike you, may see the deal beyond the person, right? And I think that's great that you can see what that deal looks like, and you can visualize it 5-7 years down the road when you take another turn at it. But really, we get in there, we do diligence, and sometimes I'm just like, I'm not really vibing with this person who's supposed to giving me the compliance, the revenue, the things like that. I feel like there's holding something back. I feel like there's some issue in there. And yeah. I'll usually sit down with the investment team and go, I don't know what it is, but there's something there. So you just probably should think about that as red flags. And I'd say 8 out of 10 times something would have happened if they went ahead and did it with that person who's no longer there a year later or whatever, because of some sort of relationship issue that you can just kind of feel right off the bat, right?
Yeah, no, absolutely. And then just to add on to that, I think creating alignment from the beginning, right? So when you're talking to a management team, founder, entrepreneur, being very transparent up front and being clear on what your expectations and what your goals are. Like, this is what we'd like to do. This is the way we're thinking about this investment. This is what we'd like to do to the business, and just setting expectations accordingly from the beginning. That way there's no surprises down the road, and just being transparent, honest with folks, typically is the way to go.
It's amazing how much that will actually get you, right? How much integrity will get you. So as we talk about here, and we've talked about this in the past, and you've watched a number of our different podcasts talk about the compliance advantage, right? And that is, how do people see compliance at their advantage or use it for their advantage in whatever situation that they have, whether it's growth, whether it's selling, whether it's buying, however you look at it. When we talk about, you said you deal with a lot of founders, right? And when you're going into a diligence, or you're looking at a specific company, and you're talking to the founders, and you're looking at things like revenue cycle, right? Payer mix, reimbursement trends, coding levels. And I know you do that a lot because that's a big piece for you. Where do you find that most companies or founders are just really unprepared when it comes to diligence, and really saying, I'm not really using my compliance as an advantage when it comes to like payer mix and reimbursement trends?
Sure. Yeah, there's a lot. I think there's a couple of things, and probably a lot of answers to that question, depending on the opportunity or the business that you're looking at. But from a compliance perspective, and maybe going back to revenue cycle management, yep. A lot of folks, and when I'm dealing with a founder, and typically we're the first institutional capital into a business. So these are family-owned business, sometimes very, very well run family owned businesses, but they're not, professionalized. So financials aren't maybe up to speed, or they're there, but there could be a little cleaner, or the revenue cycle management as far as payer collections, commercial relationships aren't as buttoned up as they should be, or maybe that founder or management team is not collecting on time, so it's taking them a little bit longer to get reimbursed than they should be because one of the commercial payers is asking for additional information on a certain claim. And so some of the things that I find, when I find that, that's fine and that's okay. And quite frankly, that's expected. But sometimes founders or CEOs, management teams, they're a little shy about that, or they're a little, they maybe want to hide that fact because they're not as proud of it. That's okay. That's what I'm here for. I'm here to help, and I'm here to enhance that and make that a much smoother process moving forward. So, I think it just goes back to transparency. I like to be as upfront as possible. So sometimes you got to get the sense that they're dancing around something. So I'll have to maybe ask a different way, or but we'll end up getting to it. So, certainly I look for transparency, but then also too as well, I will try to get a very good sense from the beginning of what I'm actually working with, where there is a need for improvement, what are the gaps today, and I quite frankly look at those as opportunities to improve. So it's not necessarily a negative thing. It's something that I know I'm going to have to clean up and fix, and I'm certainly okay with that. That's part of the reason that we're having the conversation in the first place.
I think you hit the nail on the head when it comes to compliance as an advantage. We talk all the time about transparency, right? Just be transparent. Know what you don't know. Pick up rocks, look underneath them, figure out where you're at, and just be transparent about it. It's okay. And when you look at, let's just say coding distribution across a healthcare company, right? So you have how I've seen it on both ends where people are like, they want to hide what their coding distribution is because they may be skewed one way or the other, and that may put you into a bad light. But I've also seen people who are very proud of their skewed coding distribution on one side or the other, and explain it away, and you're just like, ooh, I don't know that you can do all that. And so I think it's very interesting to think and talk to these founders who maybe, and people wanting to sell their business, about listening to this podcast and going, wow, they do really care about what my revenue is, what my coding levels are, and do we have the right distribution to not drive kind of me away or anybody else away from a certain type of deal, right?
Yep. No, absolutely. And a lot with going into coding, a lot of what I'll look at is, are they building, let's just call it a medical device, are they using the proper code? And maybe sometimes they don't know there could be 2 or 3 codes for a device, and they could be building the wrong code, and they're not doing it on purpose. But it's just the way they've been doing things for the last 5 years. And maybe a code was introduced a couple years ago. And we can come in and say, well, actually, no, you can use this code. And this actually is the way you should be doing it. I worked with Ross. We found out that, this is a new code, and this is actually the way you should be billing. A lot of folks, especially in healthcare services, they're so busy running their practices. They're so busy running the actual business and treating patients first and foremost. When it actually comes to the business sides of things, it can be a little bit of a heavy lift. And obviously going from one code to another, there's some internal processes and protocoling that has to get done. They have to let their reimbursement team, if they have one, hey, we're now billing to this code. And there's a compliance, there's obviously paperwork involved and submitting differently. And that takes time. So sometimes they just don't get around to it, or because they don't want to, or they simply don't have the time. So that's something that we certainly look out for from the beginning as well.
Yeah, in healthcare, it's pretty easy to hang your shingle and bill a code and make money, right? I mean, it's pretty simple to do that. It's very hard to do it right. And when we talk about different private equity firms that are kind of in healthcare, I know, and you and I talked about this a little bit recently, is we're seeing a lot of them walking away from healthcare companies that are really having a reimbursement exposure, right? They may be 30, 40% Medicare, Medicaid, or something of that nature. And the investment committees are just turning away from them. What do you think is driving that? And what does it mean for kind of healthcare companies to really get the capital they need to grow?
Yeah, great question. So you've seen it over the years with reimbursement trends in different industries, in different sectors, in different spaces. I think you've seen some examples of some dramatic cuts. So as an example, let's just say that you're over-indexed towards two different codes, and that's where 80% of your revenue comes from. Well, if one of those codes gets cut in half from a billing perspective and a reimbursement perspective, there goes 50% of your revenue on that one code. So that could dramatically affect the investment from an investor's perspective, where, hey, I thought we were doing 20 million in revenue, and now we're actually doing 15 or 10, or even less than that, potentially, depending on the cuts. So there is risk there. And so there's some investment groups now and some private equity firms and venture capital firms and family offices that may have gotten burned in the past, and that happened in real life, and that would certainly not be a good outcome. So they've had a troubled investment, or they've potentially lost money on one of those investments. So as an investment committee, they just say to themselves, hey, great guys, I don't care if this business has 50% EBITDA margins and they've been growing like a weed. We're not looking at anything with reimbursement. All we want to focus on is cash pay. We don't want to go down that reimbursement path again. We already got burned once. Let's not do that again. Again, it could be the best opportunity in the world, but as a committee and as a firm, they've made the internal decision just not even to bother. Let's focus our time on, we still like healthcare, we still like healthcare services, but we're only looking at cash pay businesses. Just eliminating that reimbursement risk altogether. That being said, I think there is a differentiated look at that, and certainly someone like myself, or there's many other great healthcare investors out there that do understand reimbursement and aren't necessarily scared or worried about that, because they've done their research, they understand the space, they understand the trends in that specific space, they've done their research ahead of time going into the investment, and they've really taken the time to understand the trends in that industry and then specifically to the codes tied to that business. So I think, nowadays you're either comfortable with reimbursement or you're not. I don't really see an in-between. And I've been seeing that a lot in the market now, where it's, yes, we are, or no, we're not. There's really nothing in between.
I've seen that too. And I see a lot of people who are just totally shying away from a reimbursement risk. Now, those that are really diving into that heavy kind of reimbursement risk areas, where let's just say they're post-acute and, 70-80% of their business is really coming from, let's just say, Medicare or TRICARE Champions or something of that nature. How do you see that in a diligence kind of side of the house or investment side of the house, that the company is really looking at their compliance program to say, are there really, did you understand the exposures that are out there? Do you understand? Have you been looking at it and really using that to their advantage on a deal side? Like, do you see that a lot? And what's that compliance posture?
Yeah, absolutely. So you'll, for example, let's just say that we're looking at a healthcare services business based in the Midwest, and Wisconsin may be a great state for that specific code or that specific service, but then Illinois or Ohio, they aren't as favorable. They don't have as favorable reimbursement trends because there's some type of state regulation or state regulation, or in-network, out-of-network. So a couple of things you'll look for. You'll look for what's the payer mix of this business. You'll look for, is it heavily indexed on federal, right? Or is it all 100% commercial? Are they using the Blue Cross Blue Shields, the United, the Aetnas of the world? Or is this business mostly VA and Medicare, Medicaid patients? So that's something to consider, one. And then two, you also want to look at, are these folks in network? And then what are the specific trends in that state? If it's a healthcare services business, we're using that as an example today, clearly. But if it's a healthcare services business and they have, clinics throughout 5 states, you're going to have 5 different regulations and 5 different coding regulatory bodies in 5 different states. So it could differ from state to state. So that's just something that you have to be mindful of and aware of going into the investment. It's certainly, in my experience, better to get ahead of that and find that out sooner rather than later.
This episode of the Compliance Advantage podcast is brought to you by Ronan Healthcare Compliance. At Ronan Healthcare Compliance, we believe in transforming healthcare compliance from a checkbox attitude to a strategic advantage. With decades of expertise, our team of consultants provides innovative solutions tailored to your organization's unique needs. We don't just help you meet your standards. We elevate your business, ensuring ethical practices are at the heart of what you do. Whether you're navigating complex regulations or seeking to enhance your compliance strategy, Ronan Healthcare Compliance is your partner in achieving excellence in healthcare compliance. Ronan Healthcare Compliance, redefining compliance, empowering leadership. Visit us at ronanhc.com to learn more. Now, back to the show.
You talked a little bit about in-network versus out-of-network, and I think that's a very interesting piece because a lot of compliance programs really focus on government payers, and there is no in and out of network, right? You either take Medicare or you don't, and then
Right.
you see it or you don't. But when you talk about commercial payers and in-network versus out-of-network, especially if you're doing like emergency care services in any way, shape, or form, you have the No Surprises Act that's out there as well that can really burn you from a reimbursement standpoint. And some states have their own kind of No Surprises Act as well, so you can't bill that, allowable and balance billing anybody. And I think that's really a detriment to the companies as well. So.
Yeah, no, absolutely. I mean, it's like I said, a big part of understanding that when you have a multi-state practice is really understanding the laws on a state-by-state basis.
And when you talk about like NextSpark and with the deals that you're dealing with, and we're talking, I think you do between 5 and 100 million in revenue, or maybe even larger than that. Do you see kind of differences in those reimbursement or those revenue ranges where maybe a compliance gap shows higher? I mean, obviously in the higher revenues can be a little bit more, but do you see that there may be a gap in their programs that are in the kind of maybe 10 to $20 million range too?
Yeah, I mean, typically with the smaller businesses that I look at, so if I'm doing an add-on to an existing practice and I'm acquiring one location, and that doctor or practice has been treating patients at that one location for 20 years, they probably don't have a large team, right? And they're doing things well, they're getting by, they've run a successful practice, but really to take it kind of to that next level where you're professionalizing the business, there's most likely gaps or room for improvement in the reimbursement and just billing in general. So again, there could be ways to potentially they could be billing more, they could be billing less. It's really case by case. I will say though, yes, with the smaller businesses that I've looked at over the years and continue to look at, typically they're not as optimized and they're not as professional as a larger platform where they've actually got a dedicated team of professionals that all they're focused on is reimbursement. All they're focused on are, regulatory issues on a state-by-state basis. You just don't have enough people or time when you're dealing with these smaller practices. So I would say that's absolutely the norm when it comes to these smaller businesses.
Yeah, it's interesting. I mean, I just had a conversation not too long ago with, a group that's in that lower range of revenue. And in reality, they got their first audit and they're like, oh my God, now we got this audit and we have to deal with, and they'd never had a compliance program that we'd be able to handle kind of what you do with it or be prepared for it. So really even having a conversation with someone who's spending, $100,000, $200,000 on a compliance program on an annual basis, even if your revenue is, $5, $6, $7 million a year, that's one audit, that's one exposure, that's one something that you have to pay money back that you've worked really hard to keep, right? And I'm sure when you're looking at investments and you're really in that growth stage, I mean, you're paying a multiple on that revenue that you don't want to give back, and that's a terrible thing too, right?
Right. No, I mean, we try to do that with all of our larger investments where we have a policy in place or we have, a team like yourselves in place. So in the event that we do get an audit, we hope we don't, but we do. The business is not shocked by it because, okay, well, we've got professionals that can deal with that. And maybe it's just a random audit. Maybe it's you've been doing everything right, but you got an audit. I mean, it happens, right? So we do, we try to get ahead of that. And certainly, to a smaller business, that can be a big shock and, could be the end of the world or they think the world is ending, but there is help out there. There are professionals out there that can certainly help out in the event you do get audited.
It happens all the time. It's not if or when, right? We always say that. I know you guys do a lot of like functional health that is a little bit different than your normal kind of standard fee-for-service reimbursement pieces of it, right? Preventative, lab testing, things like that. As you kind of deal into that, I think there's a lot of people moving into that realm, and it kind of goes along with that reimbursement versus cash-based business, right? That people are looking at. Do you see kind of compliance changing in those? We have a number of like med spa, health tech type companies who don't necessarily bill and collect from the federal healthcare program, but are supporting, or they have state regulations. Do you see compliance kind of working into that as a change agent for them to be able to be more supportive in growth in like tech or other kind of functional health businesses?
Yeah, I mean, right now I would say there's a lot health and wellness in general. I still, obviously a positive trend coming out of COVID, right? A lot more people are just mindful of their health and wellness. They got mindful of their sleep. They were able to eat right or eat healthy, or maybe they didn't during COVID, one or the other. And then they picked up a lot of trends. So there's been a bunch of tailwinds coming out of that that have just stuck around. I think just people in general are a lot more mindful of being healthier. And so that's attributes to a lot of the growth in the businesses that you just alluded to. You're seeing a lot with, health and wellness services, whether it be supplements, whether it be, wearables. Obviously, the wearable space is big. And then obviously in and around med spa, it's aesthetics, or even things like peptides now. And we could probably do a whole podcast on peptides if we wanted to. But that's a lot of folks, there's a lot of that down here in South Florida. So there's been a lot. And so I think there's not a lot of compliance around that now, because it is cash pay. It is cash pay business. Could that industry benefit from compliance? Absolutely. I'm sure it absolutely could. And I think the more and more popular it gets, and the more and more accepted it is within the medical community, and then with the FDA recently approving some peptides now. So I think naturally, as you see things progress and grow, and it becomes more of the norm. I think you potentially have the ability to have some insurance start covering some of these services, right? And so with that, naturally will come more compliance. But yeah, there are some groups out there that try to get ahead of that. They certainly do a better job than others. Just with having protocols in house, having things well documented, having procedures clearly mapped out. So if a new nurse practitioner comes in, this is the way we do things at the clinic. All the patient's information is clearly documented. We've got check-ins, we've got protocols. So certainly there's, I think room for improvement there, but and some do it better than others.
I think it's a very interesting trend. Like you brought it up to say, there will be insurance who are going to start covering these things, right? And especially with Medicare and Medicaid, I think it's really important. I mean, it's the whole purpose behind ACOs, right? Value-based care is to prevent people from getting sicker or going into the hospitals, which cost hundreds of thousands of dollars in the Medicare program, right? And so at some point in time, even the fee for service is, literally, I'm going to solve your problem today versus value-based care is I'm trying to prevent things from happening in the future. And I think the same thing with all this functional health and this health and wellness trend, if we can show through Oura rings, through whatever it may be, that they're living a healthier lifestyle, and therefore it is not going to affect, hospitalizations, and you're not going to have to pay for that, then insurance companies, including the government, are going to start paying and reimbursing for those care, which again is anytime you get money from the federal government, compliance goes hand in hand with that too. Plus state governments on licensure and scope of works are out there as well. So I definitely think I agree with you 100%. Like as that trend starts going, people are going to pick up on the fact that people are staying out of the hospital, and we're going to start paying for it more and more.
Right. Yeah, no, absolutely. I mean, just in sleep, we could just talk about that as an example. If you're treating sleep, or you're more mindful of your sleep, there's a lower risk of cardiovascular disease. There's a lower risk for heart disease. So taking care of yourself leads to better outcomes. And so ideally, the carriers and the payers want that. Hopefully, right? They want that to happen. They want folks to be healthier. Again, that could probably be a separate podcast in and of itself, but
the whole podcast in and of itself, just on functional health, right? And firm believer in that as well. So as we wrap up, I really want to kind of leave a message here for those founders and CEOs that are kind of listening to this podcast and trying to figure out what they need to do to get ready for an outside investment or some sort of partnership with somebody someday, and thinking not only about kind of their operational output or how they do things from a professional, we'll call professional or corporate standpoint, but along with compliance too. What do you think that they should do and the steps that they should have in order before they meet with someone like you that's very interested in their business and you're wanting to take it to the next level?
That's a great question. So I think one, understanding what a transaction, what a partnership or a transaction looks like, and then with that, understanding the types of the information that I'm going to request, and more importantly, the reason why I'm asking for it. I'm not trying to probe for more information, or I'm not trying to poke holes in your business. I'm trying to understand where I can bring value and what also I'm going to have to do when I'm partnered with you in order to continue to grow and scale the business. So a lot of it is just understanding what a transaction looks like, understanding the diligence process, understanding the reasons why we're going to have to talk about compliance, the reasons why we're going to have to understand who your payers are, what are your payer trends. Any investor is going to ask for that. And again, it's in order to continue to grow and scale the business. And most likely, an experienced investor in this space can add a lot of value there, and they can help these founders out, help these management teams out, and continue to grow and scale the business. So I think just getting ready for, there are going to be a lot of questions asked. That just right then and there, because it is a pretty big lift sometimes, depending on the business. So just preparing for that mentally is a great first start.
I often refer to it as the business colonoscopy, right? And we all in healthcare know what that means, and so we've all kind of been there. And getting your ducks in a row and being transparent, I kind of agree with you. It's like the number one thing that you can do to make sure that deal is a good deal. So I completely understand where you're coming from, and I think that's great advice. So
great.
Well, James, thank you so much for joining me today. I really appreciate it. I thought it was great insight from you, and I hope that the listeners are really understanding kind of what it takes to truly be on your radar and what you look for in an investment. And I think it's always great to be able to have this kind of conversation to make sure that everybody out there understands what people are looking for. So thank you so much for your time today.
Ross, thanks so much for having me.
Appreciate it. Thank you for listening to today's episode of the Compliance Advantage podcast. If you enjoyed it, please rate, review, and share this episode with someone who might benefit from it. Don't forget to visit us at ronanhc.com for more resources and connect with us on social media for the latest updates. And remember, compliance pays dividends. Invest today.